First, let me commend UPF for this initiative to join these discussions on the COVID-19 epidemic that is really pandemic that is really worrying everybody in the globe. You asked me to address Africa. Of course, the approach by all the governments, like other nations, is the same. The issue of social distancing to control it, the issue of isolation and complete quarantine in case of people that have been tested positive. So we are doing that. All the countries are doing the same thing. But the key challenges, by my thinking, that the African countries have, I can see that even in Nigeria, we have as a issue of testing, because the nations don't have enough of the test kits. And of course, most countries can't produce the test kits within the country, so we depend on external suppliers. And with the lockdown of the world, even to import or get this equipment is difficult. It's only the World Health Organization that can help African countries. Because yes, we're doing the lockdown, we are doing the isolation, but if there's no effective testing, then you lock down a population, and within that population, people will continue to spread. Because when you lock down a city or a state, people have to control, that security enforcement agencies will have to control the movement of the people. And the officers that are involved will also help. But in some cases, some of these officers happen to be carriers. They may be asthmatic, but they are carriers. So they themselves can even distribute, spread the virus. So the key, what we need for the world to help is to send more tests and the equipment to African countries. That will help us so much. Some countries like Ghana, they are even easing out because presently they have less than 1% mortality rate, and the rate of spread of the disease dropped significantly. So they have even reduced the restrictions. In a country like Nigeria, South Africa is still high, and the restrictions are still there. But restrictions without very, very strong testing, aggressive testing, not help the countries that much. We also have challenges in terms of distributing to lockdown cities, because some of the areas where people live is not so easy to access. It is easier in the smaller communities because there's clear identity of the people, you give to the community leaders, and the relief materials will get to everybody. But in the cities, especially in the high density areas, where people stay in crowded circumstances and environment, distributing these items becomes a major problem. That's one of the problems facing most of the African countries. And one other thing, nationally thing, that is responsible for the passiveness of the lockdown is that national government may be doing well, but how effective are the states or the provincial government or the regional government? And how effective is the city government headed by the mayors or the local governments headed by local government authorities? In some African countries, the central governments are doing well, but it does not trickle down, because for us to contain the COVID-19 pandemic, that means that the national government must work in concert and in the same direction, regional, provincial government or state governments, and they must work in concert with local governments and the city governments headed by. But in some of the African countries, this synergy is not there. The question expected at these three levels of government is not there, and that is a basic limiting factor. I wouldn't want to bore our listeners with the history of viral diseases, but Africa, we've faced similar viral diseases before, so it has given us some experience. You remember 2014, we just battled Ebola, which of course I was the president in Nigeria then when we had the Ebola incident. We've been experiencing the SARS before, the severe acute respiratory syndrome. Of course, we have been experiencing the Lassa fever. These are all viral diseases. that sometimes the behavior is similar. So we have an idea, but there are limitations in terms of having the required equipment. Even the PPE is the personal protective equipment. And people are improvising face masks, which some of them may not be good enough. So the properly recommended medical face masks, well, of course, one may say it's only medical practitioners that may use that very comprehensive one, but the people who are into managing this pandemic that move from one place to the other too need this. And also we have short supplies, people are improvising, but I believe improvised ones may not have the good quality material, and probably such people may even be exposed to more danger than even not wearing the face mask. But that is what they have, so they have to make do with what they have. The issue of personal hygiene, like washing of hands and using of alcohol-based sanitizers, been practiced. The only thing is that one is not too sure across Africa in terms of the quality of the sanitizers, because they're supposed to have a minimum of 5% alcohol. But are we sure that all the sanitizers given to people have that level of alcohol? And of course, you know, business people, some of them are not too patriotic. They exploit the situation to make money and may not even add enough alcohol, and people will buy it thinking that they are safe. But actually, they are just moving with bare hands. So I wish you there will be no time for somebody to go and begin to even examine all the sanitizers that are being used, because the whole country has been shut down and it's an emergency situation. No country can adequately prepare for epidemics and pandemics, because it comes up at a time you don't even prepare. But so far, looking at the limitations we have in terms of the capacity to manufacture this equipment that are required, and of course the economy too, the African countries are trying and they are doing well. Some countries are doing a little better than others, but for now it's only 2 African countries, I think Comoros and Lesotho, so that we don't have the COVID-19 incident, but almost all the other African countries have, though at different proportions. But the countries are working hard and will continue to work hard, but we plead that the World Health Organization need to come to the aid of African countries, especially providing these test kits, so that when the cities are locked down, when the states or regions are locked down, we will be able to do aggressive testing, so that we'll be able to isolate people that have the disease from people that don't have. In that case, within a reasonable number of days, in 2 weeks or so, you'll be able to sort out the problem. Otherwise, you continue to lock down the city and the incidents will continue, and you may do that for months and it will not work if there's no aggressive testing. I thank you so much, and I'll come back again when specific questions are raised. Thank you.